Good morning, everyone, and welcome to the Calling Path Technical Assistant Marketplace Quarterly TA Recipient webinar. With us today, as a sign of brief introductions, we have Michael Huizar, who is the Chief of the Managed Care Program Oversight Branch. Myself, my name is Lisa Bistrop. I am the Chief of the Providing Access and Transforming Health Unit. Jill Clayton, who is the Chief of our Project Coordination Section, and Glenn Tsang, who is the Policy Advisor for Homelessness and Housing on the DHCS side. Our friends over at Public Consulting Group include Trish Arizelli. She is the TA Marketplace Advisor, Jenna Wall, TA Marketplace Lead, Katie McGuire, TA Marketplace Team Member, and Eliza Met, who's the TA Marketplace Team Member. Our goals for today include transitional rent and flexible housing subsidy pools update, a TA marketplace overview and process, submitting a strong PEA, TA recipient and policy guidance, and other resources and Q&A that will happen at the end. With that, I am going to go ahead and pass over to Glenn Tsang to go over transitional rent.
Good morning, everyone. Can we go next slide, please? So as Lisa mentioned, my name is Glenn Tsang. I'm the policy advisor for homelessness and housing. So thank you all for joining, and next set of slides, I'll go over transitional rent and a little bit about transitional rent and flexible housing subsidy pools. I'll be referring to flexible housing subsidy pools as flex pools for short. Next slide, please. And next slide. So a little bit about transitional rent first. The main headline on this slide is that transitional rent was approved through our BH Connect waiver by CMS. This was somewhat of a shift, as we had previously applied for transitional rent through our CalAIM waiver. But the reason why I'm bringing this information to you mostly is just to confirm that transitional rent will still be offered through our Medi-Cal managed care plans, just like the other community supports. Additionally, transitional rent, because it's under the BH Connect waiver, it gives us 5 years of this service. And I'll talk a little bit about implementation strategies in the coming slides. Next slide, please. So a quick reminder on what transitional rent is. Transitional rent is 6 months of rental assistance for members enrolled in a Medi-Cal managed care plan and then meet certain criteria, which I'll cover in the coming slides as well. So this will be a 15th community support. The difference with this service, however, compared to the other community supports, is that transitional rent will be a mandatory benefit that all plans have to offer to eligible members. So other community supports, those are still optional services by plans, also noting that the housing trio, that's housing navigation, housing deposits, housing tenancy and sustaining services, those are still currently offered by all plans in all counties statewide. And we believe that transitional rent really complements that trio as well, providing our members with rental assistance, which we're just extremely excited about, bringing in more rental subsidy resources into California, which is just really, hard to obtain for a lot of members who might be on wait lists for, housing choice vouchers, for example, or other types of vouchers that, are just really scarce at the moment. So the fact that we can bring in 6 months of rental assistance is just, we believe, is very exciting for Californians. Next slide, please. And I pretty much covered this slide, but again, just confirming that transitional rent will be a new 15th community support under Medi-Cal managed care plans. I won't spend too much time on this slide because I kind of voiced it over on the previous slide. Apologies. So when we go to the next slide, please. All right, so here's who is eligible for transitional rent. The way I like to phrase this is that there is essentially three buckets of eligibility that members must meet in order to receive transitional rent. The three buckets are, meeting clinical risk factors. So that's behavioral health, significant behavioral health conditions, other chronic physical health conditions. But a couple that one that I do want to highlight that was just a very big win for California was the inclusion of individuals who are pregnant up to 12 months postpartum as well. So that's an additional, um, eligibility criteria for clinical risk factors that we have included, in addition to members who have physical, intellectual, or developmental disabilities. The other two buckets, the second bucket is the social risk factor. So I think that one's a little bit more straightforward. So those are for members who are at risk or currently experiencing homelessness. And then on top of that, the third bucket, that's what we call the transitioning criteria. So these are for members who are making those critical transitions in life, such as transitioning from a carceral setting, that could be county jails, state prisons, youth detention facilities, other like inpatient settings. It could also be domestic violence shelters, or also transitioning out of other systems of care, such as like foster care. Additionally, this is available for those who are experiencing unsheltered homelessness or eligible for full service partnerships. Next slide, please. So here, I wanted to flash this slide. On the far left column, you'll see POF, that stands for population of focus. Transitional rent, we will be implementing transitional rent in a phased approach. So what that means is we will be implementing by population of focus. I'll get into that, what the populations of focus are in the coming slides. But because we're doing a phased approach, I do want to just reiterate that, you still have to meet the three um, different buckets of eligibility. And so for behavioral health, those are for those who meet criteria for specialty mental health services, drug medical organized delivery system, but additionally you still have to meet the other two buckets. So that's what I'm really trying to illustrate here. Go to the next slide, please. So a little bit about our implementation timeline. Um, July 1st, managed care plans, this will be the earliest plans can begin offering transitional rent. This will be an optional go live for our plan partners. Plans can choose from any population of focus, which I'll flash on the next slide, but that'll be an optional go live beginning July 1st. However, on January 1st, we have a lot of attention to this is a mandatory launch for our behavioral health population of focus, which I mentioned previously. This will be a mandatory launch for all plans in all counties to cover, members that met those behavioral health conditions that I showed on the last slide, and also the other two buckets of criteria. So plans will begin covering transitional rent for the behavioral health population of focus beginning Jan 1, 2026, and that's a mandatory launch. This is also to line it up with a July 1st, 2026 go live of the Behavioral Health Services Act. It's a lot of timelines to try to keep straight. We're doing our best at DHCS to try to keep these timelines straight, but in the behavioral health system, they have the BHSA housing interventions, otherwise, you might otherwise know it as like Prop 1. And that essentially has for those members in behavioral health served by county behavioral health, that funding stream kind of reallocates like 30% of that funding for housing interventions. So what DHCS is doing is trying to create a connection between, transitional rent under managed care, but then also have that warm handoff with behavioral health so that members kind of have that seamless connection between transitional rent and Behavioral Health Services Act housing intervention dollars. Next slide, please. So I mentioned population of focus previously. We're going live with behavioral health, as I mentioned, on Jan 1, 2026. These are the other categories of populations of focus. One thing I'll note here is that while we're still using the same branding terminology, population of focus, just like how ECM has a similar implementation approach, our populations of focus for transitional rent are completely different than ECM. So just wanted to make that very clear first and foremost. Secondly, this menu of population of focus, one is for behavioral health, but 2 through 7, that's going to be based off of that third bucket of eligibility for individuals who meet those certain transitioning criteria. This menu does not represent the cadence or schedule of implementation for populations focus. We have not established that yet right now. Full focus is on this first mandatory launch for behavioral health. Next slide, please. All right, so with transitional rent, I think with transitional rent, I talked a little bit about BHSA housing interventions, and one thing that our department really wanted to do was look at models that can help braid and really expand the potential, of these initiatives. I think transitional rent, one thing, while it's great, it's 6 months of rental assistance. That's also the other strong consideration is that it's only 6 months, so it is time limited. So it's how do we maximize the use of transitional rent? How do we have the best strategies so it could really, fill gaps for members or serve as a bridge to other subsidies? And we felt flex pools is one way to do that. So if we go to the next slide, please. So flex pools, this is the core functions on the left. It's coordinating and braiding funding stream, serving as a fiscal intermediary, securing a portfolio of units, and coordinating with other like supportive service providers. One thing I like to just say as for like flex pools is that they're kind of like just the central, you know, operation where they interface with landlords. They ensure rent is paid on time on behalf of members. It, can go out and secure like units from landlords and create like a portfolio. But the nice thing about them is that on the back end, they have the administrative functions to bill Medi-Cal to manage care plans. They can, you know, uh, do the reporting with county behavioral health for the housing interventions. They can also, bring in other funding streams that all goes towards like braiding funding for rental assistance. So on the front end, again, making sure that members don't experience the administrative burdens and hurdles that we often face because of like the reporting requirements are often attached to these funding streams, and they can do that on the back end, so they have that kind of like that back office that could do it. Next slide, please. So again, another graphic of how we expect this to work. This is the intended value. Like, and again, we have an emphasis on county behavioral health departments, Medi-Cal managed care plans that can really flow some like transitional rent or rental assistance under BHSA to a flex pool. And that flex pool, can essentially, administer the rent and connect members with long-term rental assistance by braiding those resources and also bringing in other subsidies through county, city governments, what have you. We know that that looks, different depending on which locality that you live in. But again, it's just a model that we're leaning into. It's not a requirement for plans or counties, but it's something that, if we go to the next slide, that we've, are putting some resources into. So one, I'll point out that we recently released a Flex Pools TA resource paper. This explains and overviews what Flex Pools are writ large, their key functions, roles and responsibilities of partners. Also does a nice landscape scan of Flex Pools that exist in California. Just to be frank, there is not a lot. There's just, a few of them that exist in different sizes and scales. But that landscape scan will kind of show the different models and go over like how they're set up, because for flex pools, there isn't a one size fits all. It's really, dependent upon like the locality and the structure and the players at the table. That said, we're doing more than just webinars on flex pools and papers. We are really leaning into technical assistance at local levels. So pretty soon we'll be offering a Flex Pools TA Academy. That'll be for counties, plans to submit applications to. And, for more information, I would say please visit our very new website. It's at dhcs.ca.gov/services. If you go on that page, there's a Housing for Health webpage, which is also linked here. Um, Definitely encourage everyone to visit that webpage as is really pulling in resources and information from like what's offered under managed care, what's offered under county behavioral health, but then also Flex Pools, which has the paper, webinar recordings, and more information to come as we start to roll out the Flex Pools Academy, which we expect to launch in the next couple of months. Additionally, if you have questions or would like to learn more about Flex Pools, we have a new inbox. That's flexpools@dhcs.ca.gov. So with that, I'll hand it back to Jenna, and thank you everyone for your time today.
Thanks, Glenn. We did get quite a few, maybe like 5 or so questions in the Q&A. So, we will be sure to send those over to Glenn and his team. If you're able to stay on to answer at the end, that's great. But otherwise, we will send these out along with the materials following today's webinar. So if we go to the next slide, we'll be moving into our more TA marketplace focused portion of today. If we go to the next slide. For those of you who are new to the TA Marketplace, just a brief overview. It is an initiative that is supporting entities that are either already providing or plan to provide enhanced care management and or community supports to receive free technical assistance from our qualified vendors. Public Consulting Group is the third-party administrator for this program and will support you in your applications. If you go to the next slide. So who is eligible? We include an array of entities that may be eligible for services. What is not noted here is other. So if your organization is, again, planning or already providing ECM community supports, you are eligible as a recipient. As part of that recipient application, we do request that you provide information regarding your contracting status with a managed care plan or other entity providing ECM community supports. All of this information, including what documents must be submitted, are available on the TAM webpage. Next slide. Different project types and domains on the marketplace. So we do have our on-demand resources, which I will highlight at the end of today's call. But the 2 main types of projects that you can apply for on the marketplace are off-the-shelf projects, which are ready to go TA offerings. They include major project goals, deliverables for efficient delivery, while hands-on TA projects are really customized to the TA needs of the recipient, and it requires some collaboration with the TA vendor to make sure that you are meeting your TA goals. We have 7 different domains in which projects may fall under. Again, this information and more detail is available on the TA Marketplace webpage, including example projects for each of these domains. Next slide. So our approved vendors, we have over 100 approved TA vendors and over 500 off-the-shelf projects available. We just had our 5th procurement in January, and we intend to add new vendors to the marketplace in spring of 2025 across all 7 of those domains listed, as well as particular areas of focus. So for example, if you're a tribe or Indian healthcare provider, we will have a list of vendors that have been shown to have experience serving these provider types. Next slide. This is really meant for a reference guide in terms of your steps on the marketplace. So in that middle column there, you will see the TA recipient's role in each step of the process. The first step in the process is to complete that recipient eligibility application. Once you are approved, you will submit a project eligibility application, which Katie will go into more detail in the second part of today's presentation. Once we have approved that application, you will work with your vendor to submit a scope of work and budget, which is a bit more detailed in terms of what your project looks like, in terms of deliverables, the costs associated with the project. Again, this is free to you as the TA recipient, but will include information from the vendor about their costs. And then lastly, you are required to approve invoices for your vendors, as well as submit progress reports for any projects approved. Next slide. So just an update on where we are. We are reviewing PEAs and scope of work and budgets within about 5 to 7 business days, followed by DHCS also doing a review within 5 to 7 business days. So looking at those approvals for a total of 10 to 14 business days. Currently, we have over 1,200 projects that have been executed across almost 430 TA recipients. I will then now pass it to Katie McGuire from my team that is going to walk us through how to submit a strong PEA. If we go to the next slide, please. Thanks, Katie.
Hey, hi everyone. I am Katie McGuire, and let's talk about submitting the strong PEA now that you're an approved recipient. Let's go to the next slide. So the main point is when you go to the marketplace, it's good to identify and really think about what your TA needs really include. What needs to be resolved? What do you need help with? So some of those key considerations is review the TA domains and determine one that supports your needs. You can go through the different domains. They have the descriptions and what they fall under on the TA marketplace. There are a lot of resources there. You will also want to identify that a project type that best supports it. That's either off the shelf or hands-on, which Jenna kind of went over. Off the shelf is already an established project. It has clear objectives. A hands-on is going to be more tailored. And then we strongly encourage, once you have an idea of your support needs and either an off-the-shelf project, or maybe you're looking for a hands-on because that off-the-shelf doesn't fully meet it, please reach out to the vendor. You can go to the marketplace and it has their contacts under the vendor. If we go to the next slide. So first you're going to log in, and we refer to it as Shop the TA Marketplace. And you'll log in into your TA recipient account, and you'll explore the marketplace offerings. If you have any assistance, there is a link to that sign-up guide to help with the logging in and how to use the multi-factor authenticator. If you are pursuing an off-the-shelf project, you will select that project from the list of offerings. There are a lot of filters that help you narrow down those offerings, different vendors. If you are looking for a hands-on because you have more unique needs that are outside the off-the-shelf, then you will select the specific vendor and the domain that matches your TA needs. You can also, just so you're aware, you can have your primary vendor listed as well as a secondary and up to 3. If that primary vendor, once the review has occurred, does not have the capacity, then we would move into contacting that second vendor of choice. You are not required to have multiple, but it is an option for you. Then you'll review your selection and start your application. So now we're going to go over kind of what that looks like and what areas are going to be in the application. If you go to the next slide. So you're going to get a question for the vendor preferences. The TA domain will automatically be filled in based on the selection. You will put a project name. Please ensure that the name is unique and is descriptive of what the project's being requested. If you have other projects, please do not duplicate that project name. It will need to be sent back because they do need to be different. Then you will also next go ahead and from that vendor, you're going to give a little bit of explanation to your preference, some of it maybe existing relationships, their area of focus and expertise, maybe they were referred. If you do not have a preference or that relationship, you can write NA. We can go to the next slide. Now you're going, if it's a hands-on, you're going to describe that hands-on TA project. It's important to include those goals of the project and your organizational needs and what it's intended to address. So some of those tips are, clearly identifying the challenge that your organization is having to contract or provide high quality ECM community supports. Having clearly defined a larger goal as well as 3 to 5 tasks that are connected and will help achieve that. The goals and the tasks should include an intended approach and the expected outcomes. Please make sure that the tasks are aligned with that TA domain. And we'll talk a little bit more about that later. But you will also then select the county or counties that the requested TA will impact. If there are multiple counties, please make sure that you select all that apply. And then you'll identify your desired start date for implementation. This is an estimate, but we do advise choosing 6 to 8 weeks out to allow for the different reviews, SOW development. If you need support identifying your goals, because maybe they're broad, you're not really sure where to start, contact the vendors, discuss with them, and they will help with the approach and how to navigate submitting this application and the best route to go. If we go to the next slide. You are then going to put your organization details in it. So you'll put a primary contact on file who's going to be responsible for the progress and completion of the TA. Just noting that once that application does have a primary contact, that will not be able to be changed in the future. So just so you're aware, that is linked throughout the stage of that project. Other projects can have different contacts. You can also add a secondary contact that is also responsible for the completion of it. And you will just select that add button and it will allow you to enter that information. If we go to the next slide. So with estimating the project details, it's going to ask a little bit about the size. This is an estimation of how large and detailed this is going to be, maybe how long it's going to take. So just provide your best estimate for this specific TA. If it ends up being a little bit different, that is totally okay. It's just giving you an idea. And once you get to the scope of work, or SOW that we call it, then a more detailed budgeting timeline is going to be established. If you go to the next slide. So for this, the ECM or community supports, you're going to explain how the requested TA will strengthen your organization's ability to provide the high quality ECM or community supports for Medi-Cal members. We had already gone over one of those sections. This is a second area that you're going to enter this information. So you're going to provide the information of the current status of providing ECM or community supports to Medi-Cal members, linking those goals and outcomes, and how they're going to assist. It's also often helpful to include what your contracting status or where your organization is at, some of that information in this section, as well as if this is complementing any other projects or if there's going to be subsequent projects submitted. You can go to the next slide. This is a very important area. You're going to be asked connection to other path initiatives. So some of the questions we're going to go over, one of them being, have you received funding from and or participate in PATH? It's asked multiple PATH initiatives, so TAM, cited CPI, and JI. If you have received funds or participate in these initiatives, please include the information. So if you've received multiple rounds of cited, you will want to include that in the description. If you put yes, it will open up a box to allow you to type in the specifics. So please include if you've received multiple projects, what those are, as well as the different rounds. You can also put if it complements or expands upon connecting those initiatives, but ensuring that those areas of works are not duplicative. If you can go to the next slide. Another area of this is the non-duplication of funding. So could this project requested be reasonably perceived to be duplicative or similar of other services or projects undertaken? If you've received any other funding that could appear duplicative, please indicate yes. If there's no funding, then you would select no. But if you have received any other projects, any other funding, then you should be saying yes. You will then select the attestation of what you do select. Please go to the next one. All right, we have completed that. And now the last step is to submit your PEA. The submission page details will the next steps once the application is approved. A very helpful tip, and we strongly advise going through that application before you click that submit to ensure all sections have been completed, all the information provided, and so it's clearly identified and what these goals are really shown. So when the reviewer receives it, they know what other fundings received, and it helps mitigate any back and forth to try to get that more solid information or those questions around non-duplication. Just an example for non-duplication, it may not be perceived that there would be, but say you received cited funding for training components, and then you're requesting a domain 7 workforce training. You'll want to specify what that training was and how this new training is different. And then you will submit it. And if you go to the next slide, then it comes to the TPA review team to start their review. Just going back over the tips, goals must be clear and not too large in scope. They must align with the TA domain, as well as if this is an off-the-shelf project, it should align with the off-the-shelf project description. If there are additional areas outside that off-the-shelf, then we will probably be in communication and ask that that be switched to hands-on or reworked to align with that off-the-shelf. You will make sure that you're identifying how the project will strengthen your ability to provide high-quality ECM or community support services. And then particularly for the hands-on, please make sure that they're clear and detailed so we have a strong understanding of what the project is going to include. As well as don't forget to identify the other TA projects or other funding sources that you have received so that there is no duplication or overlap. If you go to the next slide. If once the review occurs, you may receive an email from the review team. It will give you an overview of the reasoning for additional information or changes needed based on the information provided in the application. It will also provide you with steps to request the withdrawal of this application and resubmit the new one. There are instances that you can clone this application, so we'll provide that information that's already in the previous one and allow you to edit some of the components. With the caveat to please know that if it was put in the incorrect domain and better aligns with a different one, you would need to start that application over, as it would not transfer those domains, or if it needed to be a different off-the-shelf project, that new application after withdrawn would need to be completed. If you go to the next step. All right. So once the review team has approved that PEA, we do send that selected vendor, whether it's off the shelf or hands-on, an email just to check and confirm their capacity. So once we receive that confirmation, we will then send it to DHCS for their approval. Following their approval, the SOW, or scope of work and budget, will become available in the vendor console and able to begin developing between you and the vendor. That SOW should be completed and developed in collaboration with each other. This is also one of the reasons why we strongly recommend, before submitting that PEA, that you have that conversation with the vendor, so that once that SOW is being developed, it is aligning with that project eligibility application that was approved. So just a quick recap. Basically, you will submit the PEA. Once it's approved, there'll be a capacity confirmation. Once DHCS approves it, then you all can begin developing. Once the vendor has entered the information, you will review it, approve it, and then they will submit it to the TPA review team. We will work on the review. If there's any additional questions, we'll send it back for rework specifying the areas. Otherwise, we will submit it to DHCS for their review and approval. Once that has been approved, the legal signatory entered into that individual SOW will receive an email from Adobe Sign requesting the signature. Once the vendor has signed and you as the recipient has signed, then the project can begin work once the start date of the project has occurred and the signature has been completed, whichever date is later. If we go to the next slide, I'm going to pass it back to Jenna.
Thank you so much, Katie. I hope that that was helpful to everyone in regards to walking through that process. I will now provide a brief presentation on some of the key TA recipient policies and guidance. This is available also on our TA Marketplace webpage. I have also noted it in the Q&A, the TA recipient policy guide, which was posted to the TA Marketplace webpage earlier this month. So if we go to the next slide, actually just highlighted what I was speaking to. We will be, of course, sharing this resource with you all with meeting materials, but it is available on our webpage. If you scroll to the homepage, right at the bottom, you should see it linked there. Some of the key policies and guidance include how to add a console delegate, which I've noted in the Q&A, information about changing your name, but the ones in bold here are the ones that I will be focusing on today's presentation. Next slide, please. So first, going through some project policies. If we go to the next slide, we have recently seen that there are different recipient roles that have been applying to the marketplace, and we wanted to just provide a little bit of guidance about specific TA recipient roles and how those PEAs or project eligibility applications should be submitted. So the first are our hub organizations. Hubs are an organization that represent other ECM and or community support providers. As part of the application for a PEA, if you are acting as a hub, we do request that you include the names of the organizations that will be participating in the project that you are applying for. Additionally, you should also include information about the other projects that those TA recipients that you are representing might have through other path work streams. Secondly, we are aware that there are some TA recipients that are also approved as TA vendors. What is important to note here is that those recipients that are approved as a vendor They are eligible for TA Marketplace services, but only in those domains that the recipient is not approved for as a vendor. So for example, if a recipient is approved as a vendor in domain 1, your organization will not be able to apply as a TA recipient for a project in domain 1. And then lastly, which is new given Glenn's presentation today, for those that are seeking TA Marketplace support for transitional rent services, we are requiring that you obtain and submit a letter of support that includes a signature from the County Behavioral Health Department. More information about this letter of support is available on the TAM webpage, as well as the TA recipient policy guide. If we go to the next slide. Some information about project timelines. So I know there were a few questions about this in the chat, so I'm hoping that this information will be helpful. First, and very important, is that all TA Marketplace projects must be completed by December 31st of 2026. That is due to the waiver period ending at that time. We recently sent, as part of the policy guide, we set out a intended timeline by which we will approve submissions for different TA projects as we approach that December 2026 deadline. So key dates to keep in mind here is that as of right now, we are intending that we will stop submissions of project eligibility applications on September 15th, 2026. The following month, so you have a month to have your approvals, work with your TA vendor to then submit your scope of work and budget by October 15th. And then again, just noting that any project that is approved must have an end date of December 31st, 2026. Additionally, as your role as a TA recipient, you will be required to approve invoices. That date is a little bit further into 2027. We are looking to have those invoices approved by February 15th. We will allow no cost extensions until December 31st, 2026. So please work with your TA vendor if that is something that you require for additional project time, again, until that date. In regards to project length, there is currently no policy for project length, but just note that any projects that are over a year will undergo an additional review and may require some justification. Additionally, we request that all projects be at least 4 weeks in length to just account for any project delays or changes within staffing, whatever it may be, to get you all set up. And then project start dates. So just noting that TA projects cannot begin until the project is approved by both the TPA and DHCS, and it must also be signed by the TA vendor and TA recipient. So whichever date is later of that signature or the actual project start date that has been submitted as part of that scope of work and budget. Just note that, again, we are reviewing within about 10 to 14 business days for all scope of work and budgets. So we do suggest that you put that project start date about 2 weeks after submission of a scope of work and budget. Again, projects cannot start until that signatures have been completed for the scope of work and budget, or that project start date has started, whichever is later. Next slide, please. So project development, these have been called out in particular given some submissions that we have been receiving. What is most important here, I think, for you all is for anyone that is receiving support with grant writing, that you and the TA vendor work together to ensure that this project is really meant to support TA recipients in being able to independently write grants in the future. We do have some projects related to supporting IPP and cited, but it must include that component that the TA project will allow the recipient to be able to write and submit future grants on their own. For IT infrastructure projects, we are requiring that there be a component that notes that these IT components are compatible with MCP policies. And then again, for that non-duplication of funding, which Katie highlighted, please be sure to work with your vendor when submitting scope of work and budgets to know if you have received any other path funding and describe how it is not duplicative. Next slide, please. Want to go through two processes for you all today. First is withdrawing scope of work and budgets. So if we go to the next slide. So we know that TA projects sometimes do not work out between a TA marketplace vendor and recipient, whether it be to time commitments, etc. And so while this is not desired, we do have a process in place. We have a form that is included as part of that TA recipient policy guide that just asks for information about what project you are withdrawing and the rationale for withdrawing the project. It also includes some information about invoicing so that we can properly withdraw the project at the correct time. We do request that you work with your vendor to complete and submit this form to the TA Marketplace email account. Next slide. And so this is just the kind of view of that process. So you all would first submit that form to us. We would then either look to see if invoices have been submitted or are awaiting payment or are not. If there are no invoices, we will review your request and follow up with any questions as needed, and then withdraw that project once it has been reviewed and approved by our team. If there are invoices to be submitted or invoices awaiting payment, we will require the vendor to let us know once those have been paid, and then the project will be withdrawn and removed from your queue. Important to note here is that progress reports are required for any project that was active during the time period in which the progress report is being requested, even for withdrawn projects. So we would ask for information about anything that had been completed and why it was closed. Next slide, please. And speaking of progress reporting, if we go to the next slide, this is important for any TA recipient that currently has an active project. Starting in 2025, we did move the progress reporting to be semi-annually instead of quarterly. Questions about the projects include achievement of milestones, how would you rate the vendor, any impacts of the project, including how it supports ECM and community supports, and then feedback and lessons learned. If we go to the next slide. So important to note here is that our spring TA project progress reporting period is going to be opening on April 1st, and all progress reports will be due by April 30th. If you had a project that was active from October 1st of 2024 through March 31st of 2025, you will be sent an email with a link to complete that progress report. And again, that date is April 30th by which it is due. So please be on the lookout for that email if you have an active project. Next slide, please. Also, semi-new this year, we have a TA recipient contracting survey. We did send this out last summer for those of you who have been with us since that time period, but the department is looking for information on how the marketplace may be improving your ability to contract with a managed care plan. Our team is planning to send this survey in July of this year. For TA recipients that are not yet contracted with a managed care plan, again, you will be contacted by our team with a link to the survey. It will ask for your past contracting status, and then if you have updated your contracting status, information about that, including some documentation to show that. Important to note here is that this is separate and different from the TA project progress reporting. So please be sure to complete that progress report by April 30th if you receive an email. Next slide, please. All right, and the last highlight here is just success stories. So if you don't already know, we have a Pathways to Success webpage, and we really encourage our TA recipients to share any success stories involving both the TA Marketplace or other PATH initiatives for this website. On the right is actually an example of a TA recipient that had their story shared. And to share, please email the communications team at the email listed on the slide, and include the subject line of PATH success story. And then I think we will move to our resources. I will highlight these very quickly before moving to Q&A. So if we go to the next slide. I did note that I would mention on-demand resources. So we do have on-demand resources, which are publicly available resources for anyone to use and access. We recently just added a few more resources over the past few months, and we will be adding some probably by the summer. So we encourage you to check back about seeing what has been added and may be useful to your team. That can be found on the PATH webpage, and the link is available on this slide. Next slide, please. And then again, these slides will be shared with you all, but I wanted to highlight a couple of resources. One is the TA Recipient Application Guide. This video walks you through how to determine your eligibility and how to apply. We also have that TA Recipient Policy Guide that was referenced throughout today's presentation, as well as model project eligibility applications that will support you as part of building that application to be submitted to our team. And then lastly, for sign-in and account creation guides about how to sign in, create an account for the TA Marketplace for you to successfully submit those applications. If you have any questions, please email us at ta-marketplace@ca-path.com. Our responses are typically given within 48 hours, and really appreciate your questions. So with that, I think we can move to the next slide, which just includes a request for any questions. I know that there were a few transitional rent questions that we will save for our DHCS partners later, share with those later today and include as part of the webinar materials. Let me just look to see some questions that have not been answered yet. There's some questions about timelines regarding scope of work and budgets. We understand, that folks are really trying to get their technical assistance as soon as possible. Given the volume we have been receiving, we are still encouraging again that those submissions, include that built-in timeline of the 10 to 14 business days for both PCG and DHCS review. We are trying to review as quickly as possible, but I think those are the timelines that we are currently working with. Right. Again, the PowerPoint will be shared after today's webinar. We intend to send that out in the next couple of weeks, and it also will be posted to our webpage. I see some issues regarding logins for the TA Marketplace. Again, would highly encourage you to review the TA Marketplace guide for signing in and creating an account. Additionally, we do have some information available in that video about submitting a TA recipient application about how to use the multi-factor authenticator. But if you continue to experience any issues, please reach out to that TA Marketplace inbox. Again, a person is reviewing all those questions and responding personally, and we will be sure to include our IT team if that is something that requires some IT support. Right. Seeing a question about how long it takes to be approved as a TA recipient. So we are looking at about 5 to 7 business days for that approval. I will note that we do sometimes need to request additional information from the recipient, whether it be just confirmation of some materials or asking you to provide the correct attestation form. So please be sure to check your email in the coming days after submitting the application so we can be sure to approve you in a timely manner. I see a question about, should the primary contact be the same person with the login? So the primary contact is whoever will be responsible from your side as the TA recipient for that specific TA project. It could be the same, it could not be. I would note that we do now have delegates, available, and would ask that you look at the TA recipient policy guide for how to add delegates to allow multiple members of your team access to the TA console. If you have any questions about that process, please be sure to send us an email. I also see a question about any issues with applying to the TA marketplace and cited funding concurrently. No, so long as the applications are non-duplicative. So for example, say that you are requesting a project in Domain 7 regarding training for your workforce, and then going to be applying for cited funding related to funding those employees. Those can be definitely submitted concurrently. We just would request that you note that you will be applying for that funding so that we can confer with our cited colleagues on those projects. Hey, see, looks like we are answering the majority of questions. Just seeing a note about that deadline for TA Marketplace projects. So yes, this does apply to both off-the-shelf and hands-on projects. All TA Marketplace projects, again, must be completed by that December 31st, 2026 date. Okay. Oh, a question about progress reporting. This is actually a really good question. The question is, do the vendor or the recipient complete progress reports? So there are TA vendor progress reports and TA recipient progress reports. So both the vendor and the recipient are required to complete a progress report separately from one another. This is so that we can gather information from the vendor about how things are going in terms of progress, and then also, of course, get your perspective on the products you are receiving from the TA vendor, any concerns you may have, any feedback about lessons learned. So it is required for the TA recipient to write in their own words how the TA project is going. Okay. All right. Seeing a couple of questions for cited, we can pass those along to our cited team, but would also encourage you reach out to the cited email for any specific questions regarding that grant application. Okay. Question again about progress reports. Do we require details of funds spent similar to progress reports? No, and not from the TA recipient, because we receive invoices that are also approved by you as the TA recipient. We are able to track funding in terms of what has been spent on the project. But if you have any information that you would like to share about that, please, you feel free to include that as part of the progress report if you would like to do so. Okay. Some questions about flows of applications. So again, first starting with that TA recipient application, followed by the project eligibility application, and then the TA vendor will work with you to submit that scope of work and budget. Again, the slides from today will be shared with you all and posted publicly on our website. And the answers to these questions will also be included. I want to thank everyone for your time. If we go to the next slide, just going to highlight our TA Marketplace inbox. If you have any questions specific to your organization, specific to your applications, please do not hesitate to reach out to us. We would be happy to answer your questions and really work with you all on that. And with that, I want to thank you for joining today's webinar. We really appreciate you all joining us today and hope that you found it informative and helpful. So thank you, everyone. I hope you have a good rest of your day.